I yield to the ranking member for his opening statement.
Thank you, Mr. Chairman, and I want to commend you and the Oversight Republicans for joining with us, the Oversight Democrats this Congress, in exploring ways to increase Americans' access to affordable medication. We held 2 bipartisan hearings last year to evaluate how certain pharmacy benefit managers or PBMs practices may harm patients' timely and affordable access to medicine, hurt independent pharmacies, and restrict provider care. The bill we're discussing today is intended to build upon these efforts and solve some of the problems we identified, but it's difficult to fully solve a problem before we completely understand it. Our hearings last year made clear that above all else, PBMs are operating in a black box. Both Congress and the public need a lot more clarity into how PBMs operate and how their practices might operate in conjunction with other actors in the prescription drug market, including Big Pharma, to make it harder for patients to get the care that they need at an affordable cost. Last Congress, Oversight Democrats published our findings from a 3-year investigation into drug manufacturers that revealed how Big Pharma engaged in anti-competitive behavior to keep drug prices artificially high and specifically targeted the U.S. prescription drug market for price increases. The findings from this report allowed congressional Democrats and President Biden to address these concerns in the historic Inflation Reduction Act, including by allowing Medicare to negotiate prices for some of the most expensive drugs in the country directly with manufacturers so Big Pharma can no longer exploit American taxpayers and patients. This has allowed us to dramatically reduce prescription drug prices for certain drugs. For example, for insulin, I had constituents who were spending $1,000 a month on their insulin shots as diabetics, and now that's capped at $35 a month in the Medicare program. And at the same time, we saved the taxpayers billions of dollars by letting the market work and allowing the government to negotiate with Big Pharma for lower prices. Unfortunately, there's not a similarly comprehensive report on PBM behavior or approach to the problem. Without a thorough understanding of how PBMs operate, I worry we can't know to what extent this bill will actually address the problems it tries to solve. That's why I plan to introduce a few amendments designed to help health plans and the federal government better understand the industry and PBMs' potentially misaligned incentives by establishing effective reporting and disclosure mechanisms for PBMs. Bringing sunshine to the system will enable Congress to craft and implement effective solutions. I believe these amendments are necessary to effectively address what we've come to learn about PBM's role in the healthcare system. Thank you, Mr. Chairman. I yield back.
Gentlemen.